Now it's my pleasure to introduce one of the very key individuals who helped make this conference happen. Carrie Ostrea has had many different hats. She still wears many different hats. She's conference organizer, yeah. I can't even recite her entire resume, but right now she's the executive director of NGLY1. And Carrie is here. She has many years of experience working in advocacy for global genes before her current position, and so we're very honored to have her here to talk about advocacy, which is what we are ready to do after this conference, because we have the energy and the motivation from all the families. We've heard the professionals tell us it's the advocates, it's the families who have the power, and Carrie's here to tell us how to do it. So welcome, Carrie.
Hi, guys. Anybody who knows me knows I really stink behind a podium. So how many families do we have here? Raise your hands. Okay, so for those of you in the back who are not planted in your seats, can I have you guys come up to the front? We're going to have a little bit of fun with this project. This is less of a presentation and more of kind of a workshop, so come on, don't be shy. Perfect. Come on. Get to know your neighbor. That's what advocacy is all about. It's all about community building. So thank you for those of you who are coming up. So as Andrea said, I wear a lot of hats, and like many of you who are sitting here in the room. First and foremost, I am a mom to 3 amazing kids, 2 teenagers, and my youngest, Hannah, who was diagnosed with the ultra-rare genetic disorder Gaucher disease. And when she was diagnosed at the age of 8 months, we were basically told she won't live to see her first birthday, so take her home and love her. So as many of you in the room who have gotten similar situations, our kids kind of proved the doctors wrong most of the time. Hannah lived till she was 3 years old. We fought like hell as parents, and she was our goal with her was to make her happy and pain-free. So when we got the diagnosis of Gaucher disease, we became parents on a mission, my husband and I. And so that's when I first became an advocate, because I came from the world of telecommunications and internet, and I had no idea about healthcare or anything like that. So let's see if I can do this right. Okay. So let's be honest. For those of us who are in here, none of us went to school for rare disease advocacy. It's not something you go to college for. You can't take classes. For the families in this room, you do it because someone you love was just diagnosed with a rare disorder, and you want to increase their quality of life. You want to save their life. You want to do something to help. For those of you who have felt that way when you got the diagnosis, raise your hand. You are advocates. And an advocate really just means you are working to create change. And that's what we're going to be doing here today. I'm going to help you kind of put some thoughts together on how to do that. So what comes to your mind when you think of advocacy? And I'm going to pick on a few people, and I might know you by name, and I might pick you by your shirt. So, oh, I already see somebody giving up their wife. I like this. Sorry, you're on the spot. Stand up and tell us what do you think of when it comes to advocacy? Yeah, your husband puts you on the spot. So stand up and tell us what you think of advocacy when someone says that to you. Look how embarrassed she is. Come on, guys, give her a little encouragement. There we go. So what do you think of when you think of the word advocacy?
I think of, like, great. I can't think of it. Just to advocate for my kids. So when I think of advocacy, I think of being a part of those
it's okay.
IEP meetings.
There's no wrong answer.
Being a part of those IEP meetings.
Right.
Advocate what your kids need. Like my oldest daughter just got thrown into the mainstream classes because she's too smart to be with Kaylee. So I'm trying to advocate for her to get her speaking thing, because when she gets hurt, she goes on to a nurse and they can't understand her.
Exactly.
So they don't know what's wrong with her. So that's what I think of advocacy, is just make sure that your child, you're their voice.
Absolutely. Very good. Thank you very much. All right, who else can I pick on? Only because they've got the cutest little baby boy over there. Yes, I'm pointing to you. Oh, now see, she's throwing you under the bus to say. So if you don't mind standing up and telling me what you think of when someone says, what is advocacy in the rare disease world?
Well, it's mostly stuff that my wife does, but I think, yeah, definitely just standing up for what we think our son's needs are, whether it's in the hospital or to other people out in the community. Just obviously there's very special needs, and so nobody knows it better than you do. So stand up for them.
Perfect. Thank you very much. So there's lots of different areas where advocacy is needed, and you guys touched on a couple of them, and you hit it right on the spot. Healthcare, making sure our children and our loved ones, and if you're a patient yourselves, you get the best care, get answers, get the best quality of life that your healthcare professionals can help you with. In the workplace, for some of our rare diseases, our patients are of working age, and they may have disabilities or challenges that need to be accommodated. So there's that kind of advocacy as well. The school system, which is something many of us who had kids in the school system, within the IEP 504 system, and support, family supports, community support, how your friends and family understand what your CDG type means. What does it actually mean? So I put together this little graphic, perception versus reality. Now this little graphic is just a representation of the disorders that are here today. And I just thought it was really cool, so I wanted to put it together. But as you can see, as a community, we have a lot of different subtypes, but we have a lot of commonalities as well, and that's where we really want to focus. So some more conversation with you guys. What does the general public think CDG is? Does anybody want to tackle that one?
Charles de Gaulle Airport.
Charles de Gaulle Airport. There we go, okay. That's actually a very good one. That being said, outside of the airport, if someone wants to kind of share what they try to explain to someone what a CDG is, does anybody want to share that? Or what your specific subtype is? Okay, I'm going to pick on Holly then, as she's eating. Oh, I'm really doing good today, aren't I? So what do you think the general public thinks of, your daughter's CDG type?
I usually get, does she have CP? Does she have cerebral palsy? That's a common one. If I explain congenital disorder of glycosylation, I just think they jump to a sugar. They don't like owning sugar. Also, like some type of diabetes or something like that. I usually explain that it's a multi-system or multi-organ global disease that impacts the glycosylation is a process done in every single cell type of your body. So if she has a disorder in that, it can impact all the systems.
Very good. Anybody else want to kind of share how they try to explain to their loved ones and friends? It's a tough one, isn't it? It's not something easy to answer. Yeah. Anna's going to go for it.
I've collected a number of Facebook videos because they all explain it way better than I could. I scroll over to the side of the grocery store or something, and somebody asks me about my daughter. I usually just say, she's tired. I'm tired. I'm too tired to discuss it. But when it comes to loved ones, caregivers, I think it's important that we have their own catalog of information so we can share that with them and not exhaust ourselves as well all the time.
Exactly. I think that's another common theme with CDG caregivers is it's a tiring lifestyle. So just a couple other things to think about. The stigmas associated with having a disability, having a child with a rare disease, having a child with the specific symptoms that your child is dealing with. The general public, when they don't understand something, they make their own perception of what that is. And our role as advocates really is to correct that perception. So something else I want you to think about is what is the reality of living with CDG? Kind of verbalizing how you're going to say that. Because you have, as Holly was sharing, there was a lot of different tangents. I'm not picking on you. You went into a lot of different areas. But you know what? Sometimes you don't get that much time to share what the situation is. And this is where becoming an advocate, you kind of want to kind of fine-tune your story. So we got to start by explaining what the reality is of living with CDG. To the general public, to your workplace associates. As a parent of a child with a medically complex condition, there are times you may have to take off of work, whether it's an appointment, an emergency, your child's sick, and also to school teachers and administrators. You need to be able to create a way to share what your child's situation is, what your needs are, but do it quickly and succinctly. So if someone had 30 seconds to explain the importance of CDG awareness, let's say we're going after research or we're going after money. Would you be able to explain very clearly what your CDG is, your child's association with it, how it affects your family, and why research and funding is needed? Does anybody think they could do that? Okay. Oh, okay, Bobby. No. I'm sorry, you raised your hand. You don't think I'm picking on everybody.
No, I just raised my hand because no one else did.
Oh. All right, Matt might. Because he is the expert on speaking. Does anybody have a timer on their phone or whatever? Yeah. We're going to give Matt 30 seconds to introduce Bertrand, and because you're a master at this, 30 seconds to introduce Bertrand, introduce Angle I1, and why they need to support it. So who's got the timer? Holly's got it, okay. Tell Matt when he can go.
Whenever you start, I'll start.
All right, go Matt.
All right, well, this is my son, Bertrand, and he has a disorder of glycobiology. And I would characterize glycobiology as the final frontier in genomic science, and the key to unlocking the cures to virtually every major condition facing our species today. And by studying him and the other patients with CDG, we have the potential to cure not just his disease, but the vast majority of the diseases that we all face. Something like that.
It's not easy, is it, Matt? 23 seconds. Now, do you think anything was missing from that? Do you think that the general public would understand what he was saying? Okay, so no. Matt's really smart. But this is going to be a homework exercise, and we won't go into it because I know we're kind of trying to catch up on the agenda. But I would love for everybody to make this a homework assignment over the next couple weeks, is really fine-tune within 30 seconds what your story is, your child, the condition, and why it is important for somebody to care. And we'll go through a little bit more at the end. But yes, I know you have so much more time to take on another project. But trust me, if you can get this down and be able to rattle it off, you're going to be able to create a lot more awareness. So let's talk about the different types of rare disease advocacy. There's legislative, like for junkies like me, who's going to be leaving here in about an hour and heading to DC on a red eye so I can go to Rare Disease Week and talk to our legislators about the need for treatments for our kids. Research, which is a lot of us truly believe in research needs for our kids. Support, patient support. CDG Care does a great job of supporting this community. Creating awareness. Now, awareness in the general public, and awareness and education can go kind of together. Awareness we look at as general public, whereas education is kind of educating the healthcare professionals. How many of you in the audience, when you got the diagnosis and started meeting with specialists, you had to educate your specialist on the disorder? Raise your hand if you had to educate your Okay, let me try this. How many of you did not have to educate your specialist? I feel like we need a cricket sound. And that's a really important part of advocacy. So real quickly, I'm going to have those of you who are willing to raise their hand, tell me out of these 5 things what your top 2 things are. And so if anybody wants to raise their hand, we're going to just kind of get a feel for what your passion is. Seriously, don't make me pick on you. Research. There we go. Look. All right, which 2 are you passionate about? Go for it. Yeah.
Okay. Support and education.
Support and healthcare professional education. Okay, who else wants to share? Oh, okay. Virginia?
Research and education.
Okay. Can I get a couple more people who are willing to share? Amy?
Research and awareness.
Okay. Last person. There we go, Jen.
Their current functioning in Washington, how about legislative?
You want to go with me to DC tonight? We got a lot of work to do. But as you see, everybody's got a different passion in the rare disease space, but we're all fighting for the same thing. We want a better quality of life for our children. And these are the 5 areas in which we do it. So basically, you need to find what your passion is. You don't have to do everything. There is no way any of us could do all of them. So find out what your passion is and then start focusing on that. Because once you start doing that, you're going to be able to see how much of a difference each of these steps will make. So let's talk about the different types of advocacy by the reach you have. So there's the legislative advocacy, right? Going to Washington, talking to our senators. Yes?
Are you going to share this slide so that I don't have to take notes now?
I'll share the slides. I'll give you my email. We can hop on a call, whatever you want to do.
Thank you.
And I'm being very serious. If anybody wants to connect with me to kind of push their advocacy forward, that's what I did with Global Genes for 5 years, and I loved it. And I'm excited to be able to do it with my Angli 1 friends. As Jen's like, oh. So legislative. Legislative, speaking to our congressional leaders, trying to get big policies changed. That actually has the biggest amount of reach. Because if we can make legislative changes, that could affect millions, right? So that by numbers is the biggest reach when it works. It's obviously like one of the hardest things to get done too. Anybody who has done anything in Washington in the last few years. Then it's working with the nonprofits. Whether you're working with angli1.org, CDG Care, or any of the other rare disease groups, getting involved with the nonprofit that's supporting your disorder, that's another way you can work on your advocacy. Like for us, for angli1.org, we're going to be we're revitalizing what we're doing. So we're going to be reaching out to our parent communities, parents, not our community, parent, you know what I'm trying to say. It's getting late. Because we want to bring you in. We want your help. We want to take what you're passionate about and make it work for our kids. And then community events. As Andrea said, I wear many hats. I also have my own foundation that works with rare kids in Las Vegas. And we had an event last weekend called Vegas Cares About Rare Kids. It was a 5K. But we had 500 people from the community come out. Many of them who didn't know what rare disease was, but they came out to support these kids, and they learned. So being able to have a community event, whether it's a meeting at a church or a 5K or, for those who can do big galas, go for it. That's too much work for me. But that reaches a good number of people too. Then maybe a local support group. It does, yes?
How much money did you make at your 5K?
Shush up. We made $23,000. See, but we're just one family, so all of you could do the same thing too, just so you know. We're not like anything special. Okay, we are a little special. But if you met Hannah or if you saw Hannah's pictures, you'd understand why we can do this. So going back to the local support group. It doesn't have to be your specific rare disease. It could be a special education group in your community. Creating awareness within that group. Creating an awareness with a parent support group. It could be whatever you need. And then finally, a friend or family member. Sharing your story with them. So as you see, legislative, we see, has the biggest amount of reach when it's successful. So for each of these, you see when it's successful, the amount of people it can reach. However, it just takes one person to start a movement. And I kind of wanted to share a little story about this family that I met a few years ago. She would really want to get involved with advocacy. She didn't have many friends. They didn't have the support of their community. Their child was medically complex. She's like, Carrie, what can I do to create awareness? So we came up with this school event for Rare Disease Day. And all it was we gave her some ribbons, and we had her put her story on a flyer. So she did that. She handed out the flyers to the parents at the school. The parents would donate $1 for a ribbon, and they raised about $50-something. And that was a win. She was very excited about that. Turns out that one of these parents was actually connected to a physician who specialized in a similar disorder to her child's. And with that physician's help, they did another smaller event, or another event within their church, and they were able to raise $2,500. So between the two of them, they raised $2,500. Awesome, right? So they took that $2,500, worked with the local nonprofit supporting that rare disease, and used that as a neurological seed grant for one of the scientists. Well, that research group with that $2,500 was able to provide something that had a proof of concept, which for that just means, you know what? Whatever you guys worked on, that may work. And with that, they were able to get $500,000 within 3 years to be able to work on that project. So this all started because this one woman who felt she had no friends, no family support, did something at her school. So every single one of you in this room can do something like that. You just got to feel confident and get the support from us here in the community to be able to reach out to your own community. So as you see on the bottom, it says, larger outreach does not equal the power of the advocacy, because some of us have been advocating in DC for 5, 6 years. And compared to the success of this one woman who did something at our school, you can see, you just find where your passion is and make it successful. So finishing up, going back to the 30 seconds, going back to your homework, because, yeah, you have homework. I want you guys to really start thinking about your 30-second speech. Because as parents of a child of a disorder that probably no one's ever heard of unless they know you, or they probably never run into, you have the responsibility of educating the rest of the general public, educating the healthcare professionals. The sad thing is, you know, with over 7,000 rare diseases, we cannot expect physicians to know everything. It's just not physically possible. So on top of us being parents, therapists, nurses, appointment makers, IEP coordinators, and does anybody else want to add some hats that they wear as a child? What was that? Wife? Many people still work full-time. It sucks having so much responsibility. But if you can take the time and figure out something that you can rattle off very quickly that can be impactful, that will go a long way. And just really focus on this. What is the bottom line? Why are you putting together this 30 minutes? Or 30 minutes. That would be like a real presentation. This 30-second speech, is it you want to ask for money? You want to ask this person to host an event? You want to ask for special support? So figure out what your bottom line is. And then ask, why should they care? Especially in the area of asking for money, people will only donate if they feel connected to the cause. So if you want to say, well, I want to get a mouse. I want to raise money for a mouse. Okay, go down to my basement. I'll give you one of mine, you know? But if you say, the hope that this mouse will give to my child to be able to test, future therapy, this is why I need the money for the mouse. So you see how, even though I asked for the same thing, the ask and the intention of the ask shows why they should care. And then just be yourself, because everybody in this room can pick out a phony, can't you? You know, someone who comes up with, you don't want to be too rehearsed in your speech, and you want to be authentic. That's really hugely important. And then be confident, because if I come up to Jen and say, hey, Jen, can you, let's work on this together. Can you, help me? It doesn't have the same effect as, hey, Jen, guess what you're doing this weekend? You can come over and we're going to work on this project together, right? So confidence is really key. And then finally, end your ask strong. The confidence, the authentic self. Within this 30 seconds, you can relay a lot of information and you can make a lot of progress. So that being said, I know I have a few extra slides, but this is one, I'm not going to have a share session because I know we're kind of running short on time, but something I want you guys to think about instead. Start thinking of ideas on how you can help your community. It could be as small as a little church lunch and learn. It could be something at an employer's office, just coming in and sharing your story. It could be people wearing jeans for a day where they usually have to wear uniforms, because how many know about jeans and jeans, like denim jeans and genetic jeans? That's a great catch, by the way. If you ever want to get people who don't understand what rare disease is, use blue jeans and genetics, works every time. So start thinking of things, because every single one of you in this room can make an impact. You just have to take that first step. And there are many of us here who've done this before. Andrea, myself, the mites. There are so many of us that are willing to pay it forward and help you. We want you guys to succeed. So if you have an idea for an event, come up to me and say, hey, Carrie, I really want to do this for the PMM2 community. What do you think? And I may not have the answer, but I can at least give you guidance, or I can connect you with someone else who has. We just need to work together on this, because we are the ones who are going to make a difference. We are the ones who are going to be able to fund research and drive research. And we're the ones who are going to save our kids and give them the best quality of life while they're here. So thank you guys very much.